Have you ever walked into a room and forgotten why you went in? It happens to all of us. But what if it's not just age? What if something in your medicine cabinet is silently chipping away at your memory every single day? Many seniors take medications without realizing that some of the most common prescriptions can increase the risk of memory loss, confusion, or even rapid dementia. This isn't fear-mongering. It's a wake-up call. If you or someone you love is over 50, this may be the most important video you watch this year. If you find this helpful, please subscribe and share this with a friend or loved one over 50. You never know whose life you might protect just by spreading awareness. Your support helps us continue sharing important health insights that matter to your future. Number 1. Diphenhydramine, widely known under brand names like Benadryl, is an over-the-counter antihistamine used for allergies, colds, and even as a sleep aid. It's found in countless medicine cabinets because it's marketed as safe and effective. But for people over 50, this common drug carries a quiet danger that many don't realize. Diphenhydramine is classified as an anticholinergic, which means it blocks the action of acetylcholine, a neurotransmitter that plays a vital role in learning and memory. In younger people, the brain often compensates for this temporary blockage. But in older adults, the brain becomes more vulnerable, and repeated exposure can start to affect how clearly a person thinks and remembers. Some doctors warn that diphenhydramine easily crosses the blood-brain barrier, a protective filter that keeps many substances out of the brain. Once inside, it interferes with the natural balance of chemicals that support healthy brain function. This is especially problematic in seniors whose acetylcholine levels may already be declining due to age. A study published in the journal JAMA Internal Medicine found that older adults who took strong anticholinergic medications like diphenhydramine daily for 3 years had a significantly increased risk of developing dementia, as much as 54% higher compared to those who didn't use these medications. That's a serious concern, especially considering how often these drugs are used casually for sleep. The danger doesn't stop at long-term use. Even short-term use can lead to confusion, drowsiness, or memory lapses in seniors. It can also increase the risk of falls, especially when taken at night. Falls in older adults can lead to broken hips, hospital stays, and long recovery periods, all of which can further speed up cognitive decline. And yet, diphenhydramine is still included in many PM medications designed to help people fall asleep, from cold remedies to pain relievers. The packaging rarely mentions the cognitive risks for older adults, leaving many unaware of the danger. Medical professionals and geriatric specialists have long advised against the use of diphenhydramine in older populations. In fact, it's listed on the Beers criteria, a guideline used by healthcare providers to identify potentially inappropriate medications for seniors. Safer alternatives for allergies or sleep issues do exist, and they don't carry the same cognitive burden. It's essential for older adults and their caregivers to read medication labels closely and talk to a healthcare provider before continuing use of products that contain diphenhydramine. What seems like a harmless choice for a better night's sleep may, over time, steal away the very clarity and independence that so many seniors work hard to protect. When memory is at stake, even small daily habits deserve a second look. Number 2, benzodiazepines, including well-known names like Valium, Xanax, and Ativan, are often prescribed to ease anxiety, help with sleep, or calm panic attacks. They work by slowing down the nervous system, creating a sense of relaxation and calm. While these effects can be helpful in the short term, they come with serious risks for older adults, risks that are often overlooked until it's too late. These drugs affect a chemical in the brain called gamma-aminobutyric acid, GABA, which helps reduce nerve activity. But in seniors, the way the brain processes these medications changes, often leading to stronger, longer-lasting effects that can disrupt memory, thinking, and alertness. Research has consistently shown that benzodiazepines can cause confusion, slower reaction times, and even episodes of forgetfulness in people over 50. What might begin as minor disorientation can evolve into deeper cognitive issues, especially with continued use. Studies have also linked long-term benzodiazepine use with a higher risk of dementia. In a study published in the BMJ, researchers found that seniors who had used benzodiazepines for more than 3 months had a significantly increased chance of developing Alzheimer's disease compared to those who had never used them. The more frequent and prolonged the use, the higher the risk. Beyond memory, these drugs increase the chance of dangerous falls. Because benzodiazepines relax the muscles and impair coordination, even simple movements like getting out of bed or walking across the room can become hazardous. Falls are one of the leading causes of injury and death in older adults, and these medications play a direct role in that risk. Many hospitalizations in seniors result not from illness, but from falls caused by sedating medications like these. Even though benzodiazepines are often prescribed with good intentions, they're not meant for long-term use, especially in older adults. The brain becomes more sensitive with age, and what may have once felt like helpful relief can quietly turn into dependence or daily fog. Withdrawal from these drugs can be difficult, which is why many doctors recommend tapering off slowly, under medical supervision. But awareness is the first step. The key is understanding that the very medication meant to calm the nerves may also be harming the brain, especially over time. Doctors and geriatric health experts now strongly caution against regular benzodiazepine use in seniors. Safer options for managing anxiety or sleep issues are available, ones that don't carry the same cognitive risks. If a benzodiazepine is part of the daily routine, it's important to revisit that decision with a trusted healthcare provider. Protecting long-term brain health means being cautious about what we use to treat short-term discomfort. In many cases, saying no to these calming pills today may help preserve a clearer mind tomorrow. Number 3. Antipsychotic medications like Risperdal, Seroquel, and Zyprexa were originally developed to treat serious mental health conditions such as schizophrenia or bipolar disorder, but in recent years they've been increasingly prescribed off-label for much milder concerns, especially in older adults. Some doctors use them to manage agitation, aggressive behavior, or even sleep problems in seniors, particularly those with dementia. However, these drugs come with serious warnings when used in this way. For seniors, especially those already showing signs of cognitive decline, antipsychotics can worsen confusion, blunt memory, and significantly raise the risk of stroke and early death. The irony is unsettling. Medications sometimes given to help dementia patients stay calm may actually be speeding up their decline. Antipsychotics affect dopamine, a brain chemical involved in movement, mood, and thinking. In older brains, these chemical shifts can have a much stronger and more unpredictable impact. Some patients become withdrawn, drowsy, or less responsive. Others may experience a sharp drop in clarity or emotional awareness. This isn't just a short-term side effect. Studies show long-term brain health can be deeply affected. The U.S. Food and Drug Administration has issued a black box warning, the strongest warning it offers, on the use of antipsychotics in elderly patients with dementia-related psychosis. That warning cites a higher risk of death, often due to stroke or heart failure. In one major study published in the New England Journal of Medicine, older adults taking antipsychotics had nearly double the risk of dying within a few months compared to those who were not on the drugs. Despite this, these medications continue to be used widely, Especially in nursing homes where behavior management is a challenge. These medications can also lead to a condition called tardive dyskinesia, a disorder marked by uncontrollable muscle movements, especially in the face. This condition can be permanent, even after the drug is stopped. Seniors are more vulnerable because of slower drug metabolism and increased brain sensitivity. As a result, even low doses can cause serious harm. Medical experts now strongly advise using non-drug approaches to manage agitation or sleep issues in older adults, reserving antipsychotics only for very specific, carefully monitored situations. These drugs are not meant to be a quick fix for behavioral symptoms in seniors. When used casually or for too long, they can strip away not just memory, but quality of life. Clear thinking, emotional presence, and safety can all be affected. Choosing to avoid antipsychotics when possible is not just about avoiding side effects. It's about protecting dignity, independence, and life itself. Number 4. Anticholinergic medications like oxybutynin and tolterodine are commonly prescribed to treat overactive bladder, a condition that causes frequent urges to urinate or accidental leaks. These drugs work by relaxing the bladder muscles, which sounds helpful on the surface, but the way they achieve this effect is by blocking a crucial chemical in the brain called acetylcholine. This neurotransmitter plays a central role in memory, attention, and learning. For seniors whose natural levels of acetylcholine are already declining with age, blocking it further can have serious consequences for brain function. Several large studies have confirmed the link between long-term anticholinergic use and cognitive decline. In particular, a study published in JAMA Internal Medicine found that adults over 65 who use strong anticholinergic medications for more than 3 years had a significantly higher risk of developing dementia. The risk remained even after adjusting for other health issues. This wasn't just a mild association. The risk was dose-dependent, meaning the more often the drug was used, the greater the danger to the brain. The troubling part is that many older adults take these medications for years without realizing the risks. The connection between bladder control and memory loss isn't obvious, so the warnings often go unnoticed. People may start having trouble concentrating, remembering details, or following conversations, and assume it's just part of aging. But in some cases, it's the medication quietly interfering with brain chemistry. The impact isn't only long-term. Even short-term use of anticholinergics can cause confusion, drowsiness, and disorientation in older adults. These side effects can lead to falls, hospitalizations, and a general decline in quality of life. And when multiple medications with anticholinergic properties are taken together, such as certain antidepressants, allergy medicines, or sleep aids, the effects can compound. Doctors and geriatric specialists increasingly recommend avoiding strong anticholinergics for seniors unless there is no safer alternative. For bladder issues, non-drug options like pelvic floor therapy, fluid management, or lifestyle adjustments can sometimes offer relief without compromising brain health. If medication is still necessary, newer alternatives with fewer cognitive side effects may be available. What seems like a small trade-off, better bladder control, may carry a hidden cost when it comes to memory, awareness, and long-term mental sharpness. The ability to think clearly, remember loved ones, and stay engaged with life is too precious to risk on a medication that may not be necessary. Reviewing bladder medications with a healthcare provider can be a simple but powerful step toward protecting brain health in the years ahead. Number 5. Sleep aids like zolpidem, known by the brand name Ambien, and esopicolone, known as Lunesta, are often promoted as safer alternatives to older sedatives. They're widely prescribed to help people fall asleep faster and stay asleep longer. But for older adults, these medications can do more harm than good. Even though they're not classified as traditional benzodiazepines, they still work by altering brain activity, and that can have troubling side effects, especially for people over 50. The brain becomes more sensitive with age, and the same dose that once helped someone rest can now lead to disorientation, confusion, and memory problems the next day. Studies have shown that these sleep aids can impair next-day alertness and judgment, even if the person feels rested. This is because the drugs may stay in the system longer in older adults. Some people may feel groggy, slow, or mentally foggy without realizing the medication is still active. This kind of mental cloudiness increases the risk of accidents, especially falls, a major health threat for seniors. A single fall can lead to broken bones, hospitalization, and a long recovery, often causing further cognitive decline. While the packaging often emphasizes restful sleep, the long-term use of these medications is not recommended for older adults. The American Geriatric Society has placed them on the Beers criteria list, which flags medications that may be inappropriate for seniors. These drugs have also been linked to changes in behavior, such as sleepwalking or doing activities while not fully awake, including driving or eating, with no memory of it later. Such effects are not just unusual, they're dangerous. Doctors often prescribe these medications because sleep problems are common in older adults. But sleep disturbances in aging are often better addressed through safer strategies like improving sleep habits, managing stress, or using non-drug therapies. When medications like Ambien or Lunesta are used as a quick fix, they may silently chip away at long-term brain health and independence. For those already using these medications, it's important not to stop suddenly, but to speak with a healthcare provider about safer alternatives or gradual tapering. Restful sleep is important, but not at the cost of mental clarity, safety, or memory. Protecting the brain means thinking carefully about what helps and what harms when it comes to sleep. Number 6. Tricyclic antidepressants such as amitriptyline and nortriptyline are older medications originally developed to treat depression. Over time, they've also been used for nerve pain, migraines, and sleep problems. But for people over 50, these drugs carry a hidden danger. They belong to a group of medications with strong anticholinergic effects, meaning they block acetylcholine, a brain chemical essential for learning and memory. In older adults, this interference with acetylcholine can slow down thinking, weaken concentration, and increase the risk of developing dementia. The effects may not be immediately noticeable. At first, a person might feel a bit groggy or forgetful, which can easily be mistaken for normal aging, but over months or years of use, the damage can build quietly. Studies have shown a clear connection between long-term use of strong anticholinergic medications and cognitive decline in older adults. One such study, published in JAMA Internal Medicine, found that seniors who took medications like amitriptyline daily for 3 years had a significantly higher chance of developing dementia, and that risk grew with higher doses or longer. Used not beyond memory issues, these medications can also cause daytime drowsiness, dizziness, and low blood pressure, all of which raise the risk of falls and injuries in older adults. Falls are a serious health concern after age 50 and often lead to hospital stays and loss of independence. Many seniors take these medications without fully understanding how much they affect brain function and balance. Doctors today are more cautious about prescribing tricyclic antidepressants to older adults. Safer antidepressants are available that don't carry the same risk of memory loss or confusion. Likewise, for chronic pain or sleep problems, other treatments may be more appropriate and less harmful to the brain. But tricyclics are still in use, often because they've been prescribed for years or because they seem to help in the short term. If these medications are part of a daily routine, it's important to speak with a healthcare provider about the long-term risks and possible alternatives. Protecting brain health means not just focusing on what helps in the moment, but also on what keeps the mind clear and strong over time. What seems like a helpful pill today may be quietly stealing clarity and memory, and that cost is far too high. Number 7. Proton pump inhibitors, or PPIs, such as omeprazole and pantoprazole, are widely used to treat acid reflux and heartburn. They work by reducing the amount of acid the stomach produces, offering relief from symptoms like burning or indigestion. For short-term use, these medications can be effective and necessary, but when taken long-term, especially in older adults, they can create problems that reach far beyond the digestive system. One of the most concerning risks is their potential impact on brain health. Several studies have linked extended use of PPIs with an increased risk of dementia in older adults. While researchers continue to study the exact mechanisms, one theory is tied to vitamin B12 deficiency. PPIs reduce stomach acid, which is essential for absorbing B12 from food. Over time, this reduction in acid can lead to significantly lower B12 levels, and B12 is vital for brain function, nerve health, and memory. Deficiencies may not cause immediate symptoms, but over months or years, they can contribute to mental fog, forgetfulness, and even irreversible cognitive decline. Study published in JAMA Neurology found that seniors who regularly took PPIs had a higher risk of developing dementia compared to those who didn't. Though the research doesn't prove a direct cause, the association was strong enough to prompt concern among medical professionals, especially when PPIs are used daily for long periods without regular monitoring. PPIs can also affect the balance of gut bacteria and reduce the body's ability to absorb other important nutrients like magnesium and calcium. This not only impacts digestion, but may also increase the risk of infections, muscle weakness, and bone fractures, all of which can further limit a senior's independence and well-being. These medications are often prescribed for long stretches, without re-evaluation. Some seniors continue using them for years, even after their symptoms improve or go away. This is why ongoing medical supervision is so important. Doctors can help determine whether the medication is still necessary, whether the dose should be adjusted, or whether a safer alternative might work just as well. Using PPIs for short-term relief under medical guidance is generally safe, but relying on them without understanding the risks can lead to serious avoidable consequences. For older adults, memory, balance, and long-term mental clarity matter too much to overlook. When it comes to PPIs, caution and regular check-ins with a healthcare provider make all the difference. Number 8. Statins, including simvastatin and atorvastatin, are among the most commonly prescribed medications for lowering cholesterol and preventing heart disease. For many seniors, these drugs are a key part of managing cardiovascular health. But when it comes to memory and brain function, the picture is more complicated. Some studies have raised concerns about statins causing memory loss or mental fog, while others suggest they may actually protect against dementia by improving blood flow to the brain. This mixed evidence makes it difficult to give a one-size-fits-all answer, especially for older adults. Reports of memory issues linked to statins often describe sudden confusion, forgetfulness, or trouble focusing, symptoms that can appear shortly after starting the medication. In many cases, these effects are reversible once the drug is stopped. However, they're not experienced by everyone, and research hasn't been able to confirm a clear, consistent link. On the other hand, some long-term studies have found that statins may reduce the risk of developing dementia by protecting blood vessels from damage, reducing inflammation, and lowering the risk of stroke, all factors that support brain health. The real concern appears to lie in the dosage and the patient's existing cognitive condition. High doses of statins, especially in older adults who are already experiencing signs of memory decline, may do more harm than good. Some neurologists warn that in people with mild cognitive impairment, statins can sometimes accelerate symptoms. This makes regular medical monitoring essential. A statin that's helpful for one person might be risky for another, depending on their brain health, age, and overall medication list. Another factor is the potential for drug interactions. Statins are often prescribed alongside other medications for blood pressure, diabetes, or pain, all of which can complicate how the body and brain respond. Regular check-ins with a healthcare provider can help catch early signs of trouble and adjust the treatment plan as needed. Statins should never be stopped suddenly without medical advice. But for seniors, especially those noticing memory changes, it's important to bring up concerns and ask whether the benefits of the medication still outweigh the risks. Brain health is as important as heart health, and both deserve careful, personalized care. Number 9. Gabapentin and pregabalin, originally developed to treat seizures, are now widely prescribed off-label for conditions like nerve pain, anxiety, and restless leg syndrome. For many older adults, these drugs offer relief from chronic discomfort or emotional distress, but they come with a cost that is often underestimated, particularly when it comes to cognitive health. These medications work by calming overactive nerve signals, but in doing so they can also dampen the brain's ability to stay alert, process information clearly, and form or retain new memories. In seniors, the brain becomes more sensitive to changes in chemistry. What might be a mild side effect in younger adults, such as drowsiness or slowed thinking, can turn into significant mental fog, confusion, or even disorientation in someone over 50. These effects are even more pronounced when gabapentin or pregabalin is taken alongside other sedating medications, such as sleep aids, antidepressants, or anti-anxiety drugs. This combination can severely impair coordination, slow reaction times, and increase the risk of dangerous falls. Several studies have raised concerns about the widespread use of these medications in older populations. A 2020 review in Drugs and Aging noted that these drugs are frequently prescribed without clear evidence of benefit in seniors, especially for off-label conditions like anxiety. At the same time, reports of memory lapses, sedation, and reduced mental sharpness continue to grow, particularly in patients who've been on the medications for long periods. Another concern is that these drugs can lead to physical dependence. People may start at low doses and slowly increase over time as the medication becomes less effective. The result is a cycle of rising dosage and deepening cognitive side effects, often without realizing the connection. This is why many geriatric care experts now advise using these medications with extreme caution in older adults, or avoiding them altogether when possible. When nerve pain or anxiety is a problem, safer alternatives do exist. But the first step is recognizing the impact these medications can have on memory and thinking. If gabapentin or pregabalin is part of the daily routine, a conversation with a healthcare provider may reveal better options that support both comfort and long-term mental clarity. If this video helped you or someone in your family, we have many more videos just like this, all made for people over 50. To see them, just tap the picture of our channel name under this video. It will take you to all our videos. And if you want to get new health tips every week, look for the red subscribe button, press it once, and you're all set. It's completely free. You can also tap the little bell next to it to get a reminder whenever we post something new.